What are triglycerides, and how can you lower them? Welcome to today's video. We're diving into an important topic for your heart health, triglycerides. You may have heard of them before, but what exactly are triglycerides, and why do they matter? More importantly, if your levels are too high, how can you bring them down naturally? Whether you're looking to improve your health or just curious about your body, stick around as we break it all down and share simple tips to lower your triglycerides. Triglycerides are a type of fat found in your blood, acting as your body's main energy source. They come from the food you eat, especially fats and extra calories. While triglycerides are necessary for bodily functions, having too many can become a problem. High triglyceride levels can lead to the hardening and narrowing of arteries, which raises your risk for serious conditions like heart attacks and strokes. Luckily, you can manage your triglycerides by making some healthy lifestyle changes. Being overweight, not exercising enough, and eating too much sugar can all increase your triglyceride levels. On the flip side, losing weight, staying active, and cutting down on sugar are some of the best ways to naturally lower them. Today, we're going to explore some simple ways to reduce triglycerides and protect your heart health. Let's get started. 1. Aim for a healthy weight. When you eat more calories than your body needs, those extra calories get turned into triglycerides and stored as fat. By working towards a weight that's healthy for you, and eating fewer calories, you can effectively lower your triglyceride levels. Research shows that even losing just 5 to 10% of your body weight can make a big difference in reducing triglycerides. 2. Increase fiber to lower triglycerides. Eating more fiber is a simple way to help lower your triglyceride levels. Fiber is naturally found in fruits, vegetables, whole grains, nuts, seeds, cereals, and legumes. When you eat fiber, it slows down how your body absorbs fats and sugars, which can lead to lower triglyceride levels. One study found that adults who ate more fiber had lower triglycerides, and another study showed that teens who ate a high-fiber cereal with a fatty breakfast had 50% less of a spike in triglycerides after the meal. 3. Cut down on sugar. The American Heart Association recommends limiting added sugar to 100 to 150 calories per day, but most people consume much more, about 308 calories from added sugar daily. Extra sugar is found in sweets, soft drinks, and fruit juice, and when there's too much sugar in your diet, your body converts it into triglycerides, raising your levels and increasing heart disease risks. A 2020 study found that people who drink sugary beverages regularly are 50% more likely to have high triglycerides. Even switching from sugary drinks to water can help lower your triglycerides. 4. Exercise regularly. Regular exercise, especially when combined with weight loss, can significantly lower triglyceride levels. The American Heart Association recommends getting at least 30 minutes of aerobic exercise, such as walking, jogging, biking, or swimming, 5 days a week. Studies show that long-term exercise routines are the most effective. In one study, people with heart disease who exercised for 45 minutes, 5 times a week, saw a big drop in their triglycerides. Interestingly, exercising at a higher intensity for shorter periods may work better than moderate intensity workouts over longer periods. 5. Avoid trans fats. Trans fats are unhealthy fats often added to processed foods to make them last longer. They are found in foods like fried snacks and baked goods made with partially hydrogenated oils. Although the US has banned the use of trans fats in recent years, they can still be present in small amounts in some animal products. Trans fats can raise bad cholesterol, LDL, and increase the risk of heart disease. Studies show that replacing trans fats with healthier fats, like polyunsaturated fats, can help lower triglycerides. 6. Follow a lower carb diet. Just like sugar, extra carbohydrates are converted into triglycerides and stored as fat. Eating fewer carbs has been shown to lower triglyceride levels. A review of 12 studies found that people on low-carb diets had significantly lower triglycerides after 6 months, with continued benefits at 12 and 24 months. Another review found that low-carb diets were more effective at reducing triglycerides than low-fat diets, especially within the first 6 to 12 months. 7. Aim to eat fatty fish twice a week. Fatty fish are great for your heart and can help lower triglyceride levels. This is mainly because they contain omega-3 fatty acids, which are essential fats your body needs from your diet. Both the Dietary Guidelines for Americans and the American Heart Association recommend eating 2 servings of fatty fish each week to lower the risk of heart disease and stroke. A study in 2016 found that eating salmon twice a week significantly reduced blood triglycerides. Some good options for fatty fish include salmon, herring, sardines, tuna, and mackerel. 8. Increase your intake of healthy fats. Monounsaturated and polyunsaturated fats can help lower triglyceride levels, especially when they replace carbohydrates in your diet. You can find monounsaturated fats in olive oil, nuts, and avocados, while polyunsaturated fats are found in vegetable oils, fatty fish, walnuts, flax seeds, and chia seeds. A review of 27 studies from 2019 noted that while olive oil can reduce triglycerides, it does so less effectively than some other plant oils. To get the most benefits, use heart-healthy fats like olive oil instead of unhealthy fats like trans fats or heavily processed oils. 9. Establish a regular meal pattern to lower triglycerides. Insulin resistance can lead to high triglyceride levels. After you eat, your pancreas releases insulin, which helps move sugar into your cells for energy. If there's too much insulin in your blood, your body can struggle to use it properly, resulting in high levels of both sugar and triglycerides. Having a regular meal schedule can help prevent insulin resistance and keep triglycerides in check. For example, research shows that skipping breakfast can reduce insulin sensitivity. The American Heart Association has noted that irregular eating habits are less likely to lead to good heart health and recommends eating at consistent times. When it comes to how many meals you should have, the evidence is mixed. A 2013 study found that eating 3 meals a day helped lower triglycerides compared to eating 6 meals a day. However, other studies suggest that changing how often you eat doesn't greatly impact triglyceride levels. No matter how many meals you have each day, sticking to regular eating times can improve insulin sensitivity and help lower triglyceride levels. 10. Cut down on alcohol. Alcoholic drinks can be high in sugar, carbs, and calories. If you don't burn off these extra calories, your body can turn them into triglycerides and store them as fat. Drinking alcohol can also lead to more production of large particles that carry triglycerides in your bloodstream. Some studies suggest that even moderate drinking can raise triglyceride levels by up to 53%. While light to moderate drinking may reduce heart disease risk, binge drinking can increase it. 11. Include soy protein in your diet. Soy is packed with isoflavones, which have many health benefits. Besides lowering bad cholesterol, LDL, soy protein has been shown to help reduce triglyceride levels. A review of 46 studies found that eating soy protein regularly was linked to lower triglycerides, especially in postmenopausal women. You can find soy protein in foods like soybeans, edamame, tofu, tempeh, and soy milk. 12. Enjoy tree nuts for lower triglycerides. Tree nuts are a rich source of fiber, omega-3 fatty acids, and healthy fats, all of which can help lower triglyceride levels. Research shows that eating 1 serving of tree nuts daily can reduce triglycerides by about 2.2 milligrams per deciliter. Additionally, other studies have linked regular consumption of tree nuts to lower triglyceride levels. Popular options include almonds, pecans, walnuts, cashews, pistachios, Brazil nuts, and macadamia nuts. However, keep in mind that nuts are calorie-dense. For instance, 23 almonds contain about 164 calories, so moderation is key. To maximize health benefits, aim for 3 to 7 servings of nuts each week. The bottom line: diet and lifestyle choices play a significant role in managing your triglyceride levels. Opting for healthy unsaturated fats instead of trans fats, reducing your intake of carbs and added sugars, and exercising regularly are effective strategies for lowering triglycerides. With some simple lifestyle changes, you can not only reduce your triglycerides but also enhance your overall health. There's no need to overhaul your diet and lifestyle all at once. Start by trying a few of the tips mentioned and gradually incorporate more strategies into your routine. This way, you can create lasting, sustainable changes that are easier to maintain. Thank you for watching. If you found this information helpful, please subscribe to our channel for more tips and updates. Wishing you good health, wealth and happiness.